Greetings, everyone. It's good to have you back at Einstein's Eyes. I'm your co-host, along with my partner and friend and former co-resident, John Ditkoff. As you know from seeing previous videos on Einstein's Eyes, I'm an oculoplastic surgeon and neuro-ophthalmologist. I'm fellowship trained and board certified, and here with my friend, John.
So I'm on the other side of the country. In New Jersey, while Carl is in Alaska. I'm John Ditkoff. I've been in practice for over 30 years, doing general ophthalmology, specializing in cornea. And I'm excited to hear about functional medicine tonight.
Today we have a special guest, Kelly Lorenz. You might remember Kelly from a talk on glaucoma. Kelly is a fellowship trained glaucoma specialist at Ophthalmic Associates, so she's my partner there. But there's something else that you didn't know about Kelly we're going to learn today. And Kelly is passionate about and really understands at an expert level functional medicine. And we're going to see the difference between functional medicine, holistic medicine, integrative medicine versus traditional medicine, how you treat it, how you diagnose it, some common examples, and then some anecdotes that Kelly has. And really interesting topic, which I think adds to the channel and to the ophthalmology sphere and realm, which does overlap. Kelly, great to have you here. Tell our audience about yourself, and let's kick it off with what is functional medicine?
Oh, great. Well, yeah, again, thanks for having me back. It's good seeing you guys. Even though I'm an ophthalmologist and I specialize and subspecialize in eyes and glaucoma, I've always had this interest in health of people, in a holistic sort of view. What functional medicine is essentially, it's a personalized systems-based approach to healthcare that focuses on identifying and addressing the root causes of disease rather than just treating its symptoms. And it sees the body as this big interconnected web where everything is related to everything else. For example, your gut health impacts your mood, immunity, and hormone balance. Your chronic stress affects, things like digestion, sleep, and inflammation. And then poor sleep can then impact digestion and basically mood and immune function and everything else. So it's a connected system. And there's several differences between functional medicine and conventional medicine. The biggest difference between something like functional medicine or integrative medicine or holistic medicine as opposed to conventional medicine is that we ask kind of a different core question, whereas conventional medicine tends to ask what disease do you have and what drug do we use to treat it. Functional medicine asks, why do you have this problem in the first place and what can we do to address this to restore proper function and achieve optimal health. And we look at the whole body for that. So functional medicine and holistic medicine kind of fall under the umbrella of integrative medicine, where integrative medicine includes things like, a conventional medicine approach along with functional medicine, which is like diet, lifestyle, targeted supplementation, exercise, things like that. And then holistic medicine, which also incorporates things like you might think about like things like acupuncture or some Chinese like herbal remedies and things like that kind of falls more under, I think, holistic medicine from my understanding.
So Kelly, what I'm getting is functional medicine is patient-centered. Mm-hmm. It's a patient-centered model, and it asks, why are you ill? Instead of only asking, what disease do you have? Is that?
That's right. A good analogy would be, say you have a leak in your living room, and conventional medicine would be the guy that goes in there and mops up that leak and cleans it all up. But then it keeps leaking. You got to keep going back and mopping up that leak. Whereas in functional medicine, you'd be the guy going in and finding where the leak is occurring and fixing the leak to begin with.
Functional medicine spends more time learning about your lifestyle and history to create a personalized solution. Is that correct?
That's right. That's absolutely right. In fact, while say in conventional medicine, it's very common for us to spend maybe 10 or 15 minutes with a patient sometimes, whereas in functional medicine, it's very common to, at least during initial consultation, to spend at least 60 to 90 minutes with a patient going over their entire health history from birth all the way, and you create this big timeline from birth until present, and you look at things like, were you a C-section versus a vaginal delivery? Were you bottle fed versus breastfed? It looks at major life events, including surgeries or accidents or major illnesses, even environmental exposures, infections, illnesses, medication history, including supplements and things like that. It takes a while. There are oftentimes like aha moments like, oh, my digestive issues began after this 3-week course of intensive antibiotics, or maybe my chronic fatigue started after I moved into this moldy apartment kind of thing.
Functional medicine still relies on lab testing, correct?
That's right. That's right. So we do not only just kind of what we consider standard labs that a conventional medicine would do, but we do those standard labs from a sort of a different approach. Say, say you're getting a TSH test or something, you're looking at thyroid. In conventional medicine, you may get back results that say you're within normal limits. And of course, those are sort of patient averages based upon your age and stuff. And it may not be the optimal thyroid function for you. So in functional medicine, we look at more optimal levels. So say maybe TSH, if you're doing conventional medicine, if you're between 0.5 and like 5, you may be considered normal, whereas optimal levels may be more like 1 to 2.5 or something like that. And you wouldn't get that feedback in conventional medicine. They would just tell you everything's fine, even though you may still feel pretty bad.
In a nutshell, a few themes here. So personalized medicine or functional medicine, you're really developing a partnership with this patient.
That's exactly right. That's one of the major differences between conventional medicine and functional medicine is the patient plays a very, very active role in their journey towards health. And each component of that, whether it's a diet, lifestyle, exercise, stress management, you work as a partner with the patient.
If I have somebody comes in with a cellulitis around the orbit, periorbital cellulitis, I give them an antibiotic. We follow it. Usually that works. You guys not only do that, but you also optimize treatment and you optimize their function. So you'll get labs, but then you'll talk about why did you get that? And then you'll dig into environmental factors, or was there an emotional component? Was there a stress component? And then you'll try to implement long-term prevention potentially. Is that my understanding? Is that fair?
Yeah, that's right. There are really, there's really some detailed, sort of unconventional labs that we do, often looking at things like comprehensive stool analyses, food sensitivity panels, during different nutrition assessments, hormone assessments, toxic load testing. I had one fella last year who was feeling really like brain fog, fatigue, wasn't recovering from exercise very well. I ended up doing a toxic load testing on him and found his arsenic levels were super, super high. So he ended up having his water tested and everything, and it feels much better now.
So did his wife go to jail for this?
I know, you would think. That's what you think of when you think of arsenic poisoning. But
there have been cases.
That's true.
Putting a little bit in their wife's food for a couple of months.
That would be the next thing I would do after testing his water.
Right. But Kelly, you remember we had an orthopod in town that had hardware after a hip surgery, and that was leaching out. I think it was a cobalt toxicity.
I remember that. Yeah.
And he couldn't work, and no one could figure it out. And finally, they did test that. They had to pull that hardware out of his hip.
That's crazy. Yeah,
that is crazy.
You find, and he probably, if he was going around thinking, the hardware in my hip is causing all my symptoms, there are probably people out there that just called him crazy for that.
Right. We've heard about, dental implants, the amalgam, or remember in the past, mercury.
Medicine will often pull out the mercury, or have people go in and have, the mercury pulled out of their mouths.
Right. So very interesting. So lifestyle pillars, nutrition, stress management, sleep, movement, exercise. These are all really important things is what I'm gathering. You also mentioned something that stuck when you just said targeted supplementation. You use supplements. Is it true that many Americans are deficient in what we consider normal vitamins and minerals? Almost 90% of the population is vitamin D deficient.
Oh, yeah.
Is that right?
Yeah, I rarely find on these labs, I rarely find somebody with a normal vitamin D level unless they're already supplementing with a good amount of it.
That's
So it's
wild.
critical, like what level you're starting with. For me, I especially like DNA testing or genetic testing in functional medicine because it's not about just predicting what diseases you might get. It's reveals like how your body processes various nutrients, how it handles stress, detoxifies and responds to like different like interventions. And for example, like you talk about targeted supplement selection. Um, for me, I was learning about B vitamins and whether somebody might need a methylated B vitamin versus a non-methylated B vitamin. And it can make a really big difference in how someone feels depending on different genetic variations of things like the MTHFR gene and the COMT genes. These various, in some cases, you absolutely have to have a methylated B vitamin in order to have any activated B vitamins in your system. In the COMT case, there can be variations where you might feel terribly overstimulated using a methylated B vitamin. So subtle things like that can actually make a big difference to how someone feels.
Let's
Yeah.
move on to some examples. So I know that it's three ones that I always think about when I think of functional medicine: a chronic fatigue syndrome,
Mhm.
digestive issues, and autoimmune disorders. Can you
Yeah.
can you talk about any examples that you have? Was there anything that came to mind?
Yeah, I mean, actually, that's kind of where, as a functional medicine specialist, I'm going to start with my business. I'm going to start with gut issues because everything kind of begins in the gut. If you don't square away the gut and the microbiome of the gut, then you're not going to get anything else squared away because it does affect things like immune function, and things like leaky gut can contribute to like autoimmune diseases and stuff. So, if you fix that, a lot of times you'll fix all these other issues that you think you're going to have to go down in line and fix, but you fix the gut, you fix everything else.
Kelly, what is a leaky gut? Just for our audience.
Yeah, that's where your gut lining is not really cohesive and you're actually absorbing things like toxins and stuff like that that you shouldn't be absorbing, that you should be resistant against. So you can get more infections, more inflammation. Your body, you may absorb some of these toxins. Your body is treating it as a foreign body and becomes more inflamed. And there are different things we can do with supplementation and lifestyle and diet, certainly to help cure leaky gut. And suddenly a lot of people find themselves feeling tremendously better, even with these underlying, say, like autoimmune diseases or chronic stress. They'll find their brain fog goes away, they have more energy, they're less inflamed, so their joints don't hurt as much and things like that. One patient last year who, she was young in her 30s and she thought she was feeling pretty well. And when I did the comprehensive, medical history and everything, I found out she had daily headaches that she was just living with, acne she couldn't get rid of, and I think what was it? The other thing she had, oh, like the perimenstrual, like premenstrual symptoms and stuff like that. So I ended up just doing some basic labs on her, and if her cholesterol came back really high, all sorts of, several lipid markers came back really high. She was more like what we call estrogen dominance. She had more of an estrogen to progesterone higher ratio than she should, which is probably making her feel pretty crappy. I didn't do any more specific testing on her other than I put her on an elimination diet that just for 23 days. It wasn't even that long. But yet after 23 days, pretty much all of her symptoms were gone. She had lost 8 pounds and we redrew her labs and every single one of them was normal in there. I never see anything turn around so fast. And that's in 3 weeks of just simply doing an elimination diet. She did the most basic thing you could possibly do. She already exercised a lot, but did the most basic thing you could possibly do in functional medicine, and it cured everything she had.
Let's get some takeaways. Let's summarize for our audience. So functional medicine, and help me out here if I'm wrong, can help people with chronic conditions that haven't responded well to conventional care, right?
Yep. Yep. As well, people with these unexplained symptoms and they just haven't gotten any answers to them, or people being told like your labs are normal, but they still feel unwell. And you're like, why am I feeling unwell with these so-called normal labs? Even people just wanting to optimize their health. I really like kind of an area, I guess you'd consider an area of functional medicine called longevity medicine, and you're really like super optimizing your health throughout your life. And definitely have an interest in that too. And then in general, just people wanting to seek the why behind what's going on rather than just accepting, well, I'm older now, so I have diabetes. I'm just going to take my medicine. It's people that say, I'm not satisfied with that. I want to get to the bottom of this and cure this because it is curable.
Folks seeking personalized, more preventative care, as you just mentioned. And then I think those interested in a collaborative partnership, a little different than traditional medicine that we also employ on a daily basis at Ophthalmic Associates, and John, in your practice, for our audience are going to be embarking on really a new business, a new venture. We'd love to hear about it as you develop it and launch. John, anything else?
Yeah, I had a few questions. I mean, if it's okay.
Yeah.
One is, if you read Dr. Sarno's book about back pain.
Oh, whose book?
Dawn Sarno.
Oh, okay. I don't think I've read that one. Yeah.
I would encourage you definitely to read that book.
Okay. Yeah.
It's really, and maybe we should even do another video on it. But I'll give you a 30-second conclusion on the book, which is, I mean, it's definitely a one-sided perspective. But the book was written many years ago by a rehab specialist at NYU, Dr. Sarno, who had treated thousands of people with back pain. And he came to the conclusion pretty much that you've come to in the book, which is that many people that are being treated with conventional medicine, it's not the right approach. And that actually back pain is integrated with migraines, is integrated with belly problems, and that it's related. But his theory is that it has to do with blood flow. And that he feels that when you have repressed issues that are not resolved, anxiety, tension, stress, that the way it manifests itself in your body physically is that it decreases blood flow to different parts of your body. And it can actually alternate. So he even talked about patients that had back pain that resolved, and then immediately they had gut issues. And then that went away, and then they started having headaches. So they needed to manifest themselves physically.
Yeah.
But it was really, they needed a functional approach. That's one thing. The other thing I think you brought up, which is really important, is that anyone out there, for example, on a cholesterol medication, you need a doctor there that's not just treating you. You need someone that's looking at the overall care, because, for example, CoQ10, a lot of patients don't realize how important CoQ10 is when you're taking a statin. So a statin, it can make you feel like crap. But if you're on CoQ10, you feel a lot better.
Yeah, exactly.
Yeah, and the last question I have is really about eye health, because as I read the book, I started to think, so this guy's coming up with all these things, the belly, the head, everywhere. What about the eyes? I'm like, I don't know. I take the cataract out, take it out, the vision's good. I don't see any functional component. But, there probably is with glaucoma. There probably is with dry eye. There probably is with uveitis. So a lot of the things, as I was reading the book, so what do you think of that? I mean, you're a glaucoma specialist. Do you think?
Absolutely. I think that definitely comes into play. In fact, I've talked to patients about, theories behind like normal pressure glaucoma. They're like, well, if my eye pressures are not high, why would I even have glaucoma? And well, there's the theory that it's a blood flow issue to the eyes. So
that's interesting that's right from Dr. Sarno. That's a blood flow issue. It's interesting that it really kind of all circulates around that one theory. So I would encourage you to read the book.
No, I'm super interested. I'd love to read the book.
Takeaways: people with chronic conditions, looking for personalized preventive care, the why, interested in collaborative partnership with their functional medicine doc. That's the place for you. Traditional medicine is good. We practice it. You got 3 physicians here, but there are alternative types of medicine that can also be explored if you don't get what you need, if you're not satisfied. So thanks a million, Kelly. Thank you so much for being here. We'll have you back on.
Yeah.
John, always good seeing you.
That was great.
And we'll see you guys on the next one. Thanks.